When you hear about fatty liver, you might say, is that even a big deal? Everyone has a fatty liver. But this is where the real problem begins. Patients do not take fatty liver seriously as a disease until it reaches a critical stage. However, contrary to popular belief, fatty liver is a significant issue. So, what exactly does fatty liver do? Let's examine it together and gain a better understanding. There are primarily two types of fatty liver. The first type is alcohol-related fatty liver, which is less common today. More common is non-alcoholic fatty liver disease, NEFLD. Fatty liver can be defined as having more than 5% of the liver's mass as fat. If you think that fatty liver is just about an increase in fat in the liver, you're definitely mistaken. When fat accumulates in the liver's functions are disrupted. When the liver's functions are impaired, it becomes harder to control your blood sugar. The liver plays an essential role in storing sugar and eliminating many hormones from the body. When the liver does not function properly, these hormones fluctuate constantly. This situation is especially common in men because the female hormone estrogen is cleared from the liver. Yes, we see that many people with liver disease have enlarged bellies. This is because the body cannot clear out the female hormone. Thus, one of the significant reasons why men have more female hormones nowadays is due to fatty liver. Additionally, the liver plays an important role in skin conditions. It's common to check the liver in individuals with acne because this condition is frequently observed. Fatty liver causes constant fatigue, which significantly lowers the quality of life for people. Yes, you become tired. Along with that fatigue, it becomes harder to move. Even if you do exercise, it's more difficult for people with fatty liver to lose weight. We know that many people who struggle to lose weight also have fatty liver. The liver also plays a big role in your cholesterol profile. It is responsible for producing, exporting, and recycling cholesterol molecules. The liver acts like a brain in this respect. Therefore, we see that people with poor cholesterol profiles often have impaired liver function and even fatty liver. When the cholesterol structure is altered, its frequency, type, and quantity change, leading to heart disease. We can say that liver diseases are actually at the root of heart diseases. There are numerous studies confirming this. Many heart diseases are more prevalent in people with fatty liver. I don't even need to mention that, like with everything else, the frequency of cancer increases with fatty liver. Cancer is now the disease of our time. When we gather all these conditions, if you asked how much risk a person with fatty liver is under, studies show that the risk of death for people with fatty liver is 70%, higher compared to those without it. This is a significant figure. And could you have guessed that this situation could be due to a simple fatty liver that nobody takes seriously? Probably not. Now that we know fatty liver is this serious, there are actually some very simple things we can do. The treatment is surprisingly simple. I'm not going to recommend any drugs. At most, you can benefit from natural supplements. However, changing your lifestyle is almost the only solution to treating fatty liver. So, even if you wanted to, there isn't really a rational drug available. Therefore, you need to change your lifestyle. Okay, you want to move on to treatment, but let's first look at the causes of fatty liver. We've already looked at the consequences. It leads to many diseases and increases the risk of death. So, what are the causes? Because without knowing the cause, this disease cannot be treated. In many diseases, we first need to know the cause so that the disease can be treated by eliminating it. Otherwise, we would only be saving the day. Now, the most important cause of fatty liver is high blood sugar and insulin resistance. When your insulin levels increase, your body, including the liver, begins to produce fat. When fat production starts, the liver begins to store more of this fat. So, when we look at it, it's not fat but sugar that causes fatty liver. No matter how much fat you consume, if it's a quality fat, it does not cause fatty liver. However, sugar, by raising your blood sugar levels, leads to fat accumulation in your liver. Of course, the issue is also connected to insulin resistance and obesity. We know that when insulin resistance increases, a person gains weight. Thus, indirectly, obesity insulin resistance, and high blood sugar lead to fatty liver. Another factor is toxin exposure. Our world is now full of toxins. These toxins are continuously cleansed by the liver. In fact, the most important thing the liver does is detoxify the body. The primary chemicals and toxins involved are the drugs we use. Of course, I'm not saying don't use medication, but using too much is harmful. Or if you have insulin resistance and instead of losing weight, you're taking medication for it. That's an entirely different kind of nonsense, because you don't need it. By eating less or eating right, you can treat insulin resistance, but instead, you're using a routine medication. This harms you. Therefore, many medications can contribute to this condition. Everything from painkillers to stomach medications can cause it. The use of these medications can lead to serious fatty liver. In fact, many cholesterol medications are also a significant cause of fatty liver. Speaking of toxins, we need to talk about agricultural chemicals. Many agricultural chemicals are toxic to the liver. We know that fatty liver is more common in areas where agricultural chemicals are used, and among people who consume these products. We know that part of the reason why fatty liver is so prevalent today is due to agricultural chemicals. There were very obese people in the past too, but when we look at these people, fatty liver was not as common as it is today. The problem is toxin exposure. Speaking of toxin exposure, besides agricultural chemicals and other chemicals, gut health is also very important. What you eat is digested in your intestines. Your intestines send these to the liver to be metabolized. No food enters the bloodstream without being metabolized. And here the liver plays a crucial role. The more often you eat, the more your liver is taxed. The worse your diet, the more chemicals your liver has to clean up. If your intestines are leaky, that is, if you have leaky gut syndrome, you're definitely exposed to more toxins. Normally, the intestines act as a filter, and bad molecules don't pass through this filter. But if you damage this filter, you become exposed to more toxins. I have encountered many people with leaky gut syndrome and fatty liver, and celiac disease patients are a perfect example of this. So, gut health equals liver health. Leaky gut syndrome is a very important cause of fatty liver, and hardly anyone is aware of this. Another issue is fructose consumption. Fructose is known as fruit sugar. However, excessive fructose from fruit, sweeteners, and especially high fructose corn syrup is the only sugar that is converted to fat in the liver, leading to fatty liver. Along with this, there is another very important issue: physical inactivity. The reason many people have fatty liver nowadays is due to inactivity. People don't get fat when they eat less and stay inactive. People get fat when they stay inactive and eat a lot. Therefore, the treatment for fatty liver is actually a little more movement and eating less. When we look at the causes of fatty liver, these are the basic ones. Besides this, thyroid diseases are also important causes of fatty liver. In fact, thyroid diseases like insulin resistance are both a cause and a result of fatty liver. Because of these reasons, fatty liver becomes a vicious cycle. Everything causes fatty liver, and fatty liver leads to many diseases. This is why fatty liver is such an important issue. Fatty liver, which seems insignificant, causes a person to have many diseases like heart disease, vascular disease, chronic fatigue syndrome, cancer susceptibility, hormonal imbalance, obesity, and more. Fatty liver is a significant health problem. Let's move on to treatment. We've learned the causes, so now let's focus on treatment. The treatment is actually quite simple and not confusing. There are no complicated prescriptions or long-term treatment methods. There are a few methods that everyone can easily apply at home and test for themselves. If you have fatty liver, you can try these methods after consulting your doctor. After a few months, you can have another ultrasound to check your condition. First, I want to talk about milk thistle seeds. Milk thistle seeds contain an important substance called silymarin. This substance helps regenerate liver cells. In other words, it's the liver's unique repairman. You can consume milk thistle seeds in capsule form or as tea. You can easily find the tea recipe online. I also want to mention vitamin D, turmeric, fish oil, and melatonin supplements. These supplements reduce insulin resistance, help your body fight toxins better, and support your liver. However, you should consult your doctor before using these supplements. I also want to touch on methylation. If your methylation processes aren't working properly, your liver can suffer more damage. One of the most important indicators of this condition is homocysteine levels. Your homocysteine level should ideally be between 7 and 8. If your levels are high or low, your doctor will tell you how to balance them. You also need to review your sleep. People with sleep apnea have a higher risk of fatty liver. You can assess your risk for sleep apnea by asking people around you or using phone apps. We know that sleep apnea and insulin resistance lead to many diseases, including fatty liver. A low-carbohydrate diet is also important for liver health. You can follow this diet to balance your blood sugar levels and prevent fatty liver. However, this is a very strict diet, and you should be careful not to harm yourself. Finally, you could do a liver detox. This detox can be done by drinking water with lemon in the morning, consuming garlic and onions, and increasing your fiber intake. These treatments will benefit you significantly, but please consult your doctor before applying any of these methods.